not share slides because my task here is not to present a specific technology, but sort of distill the ethical implications of what we've talked so far, with special focus on digital surveillance. And Ricardo has already showed the main ways through which digital surveillance can be deployed, namely proximity and contact tracing, monitoring activities such as quarantine compliance, and providing mobility reports, as companies like Google are doing right now. But so from an ethical perspective, I will start with a trivial but I think important observation, and namely, it is certainly ethically challenging, especially from a privacy perspective, to use digital data for disease surveillance purposes, be it proximity tracing, contact tracing, quarantine monitoring, or other application. However, we should keep in mind that it's also ethically challenging not to use digital data if the processing of those data can help mitigate the contagion and save lives. So what we are facing here is a very complex moral dilemma. And the greatest challenge for us as researchers and policy experts, but also as societies at large, is balancing conflicting rights and ethical values. So I would personally argue that a certain temporary sacrifice of privacy rights can be ethically justified if it saves lives. So, for example, if it reduces preventable deaths and new infections, and it is proportional to the public health needs that we're facing today, and leads to a faster restoration of other rights and freedoms that were temporarily interrupted due to lockdown policies, such as the freedom of movement and freedom of assembly. However, if we sacrifice some degree of informational privacy for public health purposes, in the name of digital disease surveillance, we need to be very clear about the conditions under which this trifling of privacy is allowed and for how long. So we need a clear expiry date and how privacy will be restored after the pandemic is over. I wrote an article with Professor Ienca, which came out recently in Nature Medicine, which we suggest some basic criteria for mobilizing big data and digital technology, especially smartphone-based contact tracing during the coronavirus pandemic in a responsible manner. And this includes the principle of proportionality, the use of privacy-preserving technology, evidence-based approaches to tool development and deployment, and other requirements. However, in my short input statement, I would like to raise more general discussion points that I think encompass some of the discussions that we had so far. So one is the state of exception that we are facing today. Now, it's quite clear to policy experts that epidemic response is a rare circumstance in which governments make quick decisions about the collective good, including decisions that might be in contravention of individual human rights. And this is results in what legal philosopher Carl Schmitt called the state of exception, namely sovereign state's ability to transcend the rule of law in the name of the public good. Especially during a time of crisis. And this can include the ability to diminish or supersede on constitutional rights. And other philosophers like Giorgio Agamben further investigated how this suspension of laws or modification of laws within a state of emergency or crisis can become a prolonged state of being, in which individuals are deprived of their rights. And now what we see during this COVID-19 crisis is that governments all over the world are already limiting some constitutional freedoms, such as the freedom of movement, freedom of assembly. They are permitting the expedited testing of treatments and vaccines. And I'm not going to say that these approaches are necessarily morally questionable. They are very well justified due to the public health crisis that we're facing. But there is a concrete possibility that the next logical step is indeed deploying pervasive mass surveillance regimes that can leverage novel digital tools. And this can be predicated upon the exceptionalism of the situation that we're facing. So digital technologies can be used as new mechanisms of social controls, and this can be introduced at an accelerating pace also bypassing the traditional checks and balances that might prevent them from being approved under less chaotic circumstances than those that we're facing today. It's important here to point out that there is never a guarantee that the civil liberties and digital rights will be swiftly restored after being taken away. And this is a point that historian Yuval Harari made very boldly in his Financial Times column recently. And we already have examples of this. The USA Patriot Act after 9/11 is a good example of a prolonged state of exception. And now we've seen also semi-authoritarian regimes like Orban's Hungary institution powers by decree without a clear cutoff date. So there is a high likelihood that the heightened digital surveillance technologies implemented during this emergency will remain, at least in some countries, even after the pandemic has abated, and they will continue to accelerate that process that we've been calling in the privacy domain the erosion of privacy, or even the end of privacy around the globe. And we have to be realistic because probably it's not in our power to eliminate this risk of privacy erosion. What we can do is probably help contain the extent to which this public health emergency will lower the bar of privacy worldwide. And this also leads to the second problem, which is the one that you, Jean-Marc, are an expert about, namely the problem of repurposing at dual use. So there is a legitimate risk that digital tracking could be used not only for tracking new infections, but also applied to other intelligence or surveillance. For example, one New York Times report found that Health Code, government-run Chinese app, technical support is provided by Alibaba, and that supports decisions about who should be quarantined for COVID-19, also appears to share information with law enforcement. So it is important for health authorities and governments to distinguish digital tools that allow this third-party sharing of information for non-health related purposes from those that do not allow that. And then there is the important topic of scientific validity and accuracy. Precisely because new digital surveillance tools are menace to privacy rights, governments or private companies should not be granted these surveillance powers unless they can show to the public how these powers would actually help in a significant manner to help or contain or mitigate the COVID-19 emergency. So efficacy should always be the first issue to raise in the deployment of these technologies and in their ethical assessment. Because if a proposed intervention is not efficacious, there is no reason to deploy it, because its unavoidable negative effects on privacy and individual rights won't be compensated by any significant public health benefit. And for example, this is very important for big data, because if the digital tracking models, for example, are insufficiently validated, they might display high error rates, especially on the large scale, which in turn can be detrimental to public health. Imagine if you have a tool that sends the wrong people to quarantine and isolates those that should not be isolated, while letting freely circulate those people that should be in contrast be quarantined. And today we have no solid evidence that the collection of data using technologies like GPS is proven to be effective in tracking the spread of a virus. And we also have a long history of failures when it comes to digital predictions and tracing. Some of you might remember Google's flu trends that failed that misjudged the peak of the 2013 flu season by about 140%, so a big error rate. So scientific validity of digital tools must be proven and not presumed. Now, some people could argue that we have a sort of digital right to try, so that, given the extent of the current emergency, we must try everything, just in case a technique might turn out to be useful. And I would argue that this is both scientifically and ethically unjustified, because if the numbers of false positives, for example, and false negatives are significant, then we could have detrimental effects on public health, not neutral effects. And we can also divert resources and attention from more effective public health strategies that maybe do not leverage on digital but on analog tools. And then, so there are three main risks from a more technical perspective. These are compelled and coercive use of digital surveillance tools. And we have already seen some applications of smartphone-based apps or other tools in which end users, so the data subjects or data generators, do not have the right and ability to opt out or to explicitly consent to their to the use of data. And this is, of course, a menace to individual and group privacy. And then there is also a problem of transparency, especially if the agreements, the data sharing and processing agreements are non-transparent, but also if the source codes are opaque or closed. So what I see here is general agreement growing at the EU level, but also beyond, that any digital surveillance technology, to be ethically aligned, should be non-coercive, transparent, open source, decentralized, and privacy preserving. And there are notable approaches, such as a pan-European project trying to develop a decentralized, privacy preserving proximity tracing app that seem to go exactly in this direction. And then on a very, very final note, I want to highlight, because we've been talking a lot about digital tools and novel technologies, but although digital tools can be of great benefit to public health, they will not spread the coronavirus alone, but only in combination with other parallel public health strategies. So from an ethical perspective, a global health ethics perspective, it's very important not to be reductionist, but pluralist, and consider that other strategies such as aggressive testing and ultimately the development of a vaccine are extremely important, because it is possible that by using proximity tracing apps, we can identify the movement and map people who have been infected with the virus or are at high risk of being infected with the virus. But then if we don't have large-scale testing capabilities, then we cannot test those people that the apps identify as at high risks. And if we cannot determine if these exposed people are actually infected, then this public digital health surveillance strategies are actually way less effective than they could be. So we need to keep this broad perspective in mind as well.